we went out, we're doing everything in our power to keep the sick and infected people from coming into our country. We're working on that very hard.
Trump on the coronavirus tonight as we're getting an inside look from the Washington Post of his administration's response to the virus thus far. And this gets your attention. Quote, interviews with nearly 24 administration officials, former White House aides, public health experts and lawmakers, many speaking on the condition of anonymity, portray a White House scrambling to gain control of a rudderless response defined by bureaucratic infighting, confusion, and misinformation. It's complete chaos, a senior administration official said. Everyone is just trying to get a handle on what the expletive, use your imagination, is going on. Meanwhile, officials in Georgia have just since we've been on the air announced 2 new cases of coronavirus. With us for more, Dr. Irwin Redlener, a pediatric physician, co-founder of the Children's Health Fund, now a clinical professor with the School of Public Health over at Columbia University, and the director of Columbia's National Center for Disaster Preparedness with an expertise in pandemic influenza. His business card is 7 inches long. Ron Klain, a political veteran now informally advising the Biden campaign, among his many roles in the White House over the years, working with Dr. Redlener, he oversaw the response to the Ebola outbreak during the Obama presidency. Ron happens to be the co-host of a new podcast about the coronavirus called Epidemic. And Ron, since you guys are colleagues, I'm going to start with you, but ask you both in order to answer the same question. What do you see out there that needs doing, that's not being done? What's perhaps being done wrong?
Yes, I think we're seeing a crisis of both confidence and competence at the Trump White House. The confidence crisis comes from the fact that the president keeps on saying things that aren't true. And he's finally run into an opponent he cannot tweet into submission. The coronavirus is not going to be impressed by Trump's tweets. And so he keeps on misrepresenting the state of the disease. He keeps on misrepresenting the state of progress on things like the vaccine. That erodes the power of his communications on this. On the competence side, the administration put in place travel restrictions to slow the spread of the virus to the United States, but didn't use the time that bought to get this testing problem sorted out, to get our hospitals ready. They're just not moving with pace and speed to put the response into place. So a lot of bad communications and a lot of failure to really execute on the response that should be going underway now.
Doctor, same question.
Yeah, it's pretty much the same basic answer. And I'll tell you that the miscommunication issues are extraordinary. What we witnessed in a press conference just a few days ago was Donald Trump saying everything's under control.
Fictional numbers of patients.
It was just absolutely absurd. And then like 5 seconds later, his health experts saying it's just a matter of when, not if, we're going to get a massive deterioration in the situation. And Trump was promising us a rapid development of a vaccine, which is completely absurd. That's going to be 12 to 18 months, if we're lucky, away. So everything about it totally undermines the public's confidence in messages coming from leaders. You know, what a good leader should be doing is finding that middle ground between telling people what we're doing and what we are worried about, and on the other hand, not creating panic. Trump seems not to have that particular inherent skill that we would like to see in our politicians. And I'm telling you, when the postmortem is written about this whole episode, the incompetencies throughout the federal government have been extraordinary. And I think people would be shocked to see how many errors in judgment, in mismanagement, and so on. And I think Ron mentioned the issue of the testing. That was a unbelievable failure of a competence that we should be having without question. We're so far behind other countries in terms of figuring out how to screen people in large numbers, and there's just no forgiving this.
Let me ask you a question that people ask me, and being a New Yorker, it's probably helpful because as a public health specialist, you get to work in this laboratory every day. How long do you reckon until we really have to change our public behavior?
Well, first of all, we actually have been in a pandemic for some period of time. This is a pandemic, so pussyfooting around that is not helping anyone. We're going to have to change behavior as soon as we hit some trigger points, which have to do with the number of cases in a particular area. And by the way, those public health methods will be very draconian and disruptive for people. Like closing schools, like shutting down athletic events, like closing down theaters on Broadway. These are things that may have to happen if we have to keep people separated so that we don't increase the transmission, of this contagious illness. And when are those going to happen? It's a day-by-day situation, Brian. We don't know. Tomorrow we may get news that there's been a massive increase in the number of cases reported around the country. And we'll start to see health departments saying, listen, we're going to have to close some schools for a while, which has tremendous effects on families. A lot of parents cannot afford to stay out of work so that they can stay home and watch their children. I don't know how we're going to deal with that because families' incomes are dependent on them working. And then the economic consequences in their community and beyond are just absolutely awful. And we have virtually no imagination when it comes to trying to figure out what we're going to do about these secondary and cascading consequences.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.